After I had my babies, I was left with a body that I barely recognised. I mean, so much had changed. I felt incredibly lucky. The births went well. But I do wish that someone had given me a heads up on the physical toll that it would take on me. I mean, women go through such significant changes during pregnancy and childbirth. It's unfair to expect our bodies just to bounce back. But there are so many unsaid things about the impact having a baby has on a woman's body.
Unlike many other European countries, our NHS offers very limited aftercare for new mums, which could be why so many women suffer from various health conditions after their pregnancy and birth. But there is help out there if you know where to look.
I'm really excited because I'm about to go and meet a group of brand new mums for a physiotherapy session to find out how their bodies are recovering after giving birth. I'm really looking forward to comparing notes.
All over the country, there are specialists who can help.
Can you feel that? Can you switch it on?
Hi, can I join in?
Of course you can.
Thank you.
The most common issues are trauma to the vagina and vulva, damage to the pelvic floor muscles, and back pain and posture problems caused by overextended abdominal muscles. This clinic is run by physiotherapist Elrina van Zyl.
Unfortunately, and what happens a lot of the time, you've just had a baby, you often have a second one.
Yeah.
You haven't had the care that you needed, you haven't had the education that you needed. And then you come and see us, 10, 15, 20 years down the line, once you've got your brain back. And you kind of think, oh, what about me? And I've still got this back pain that started postnatally. And that's one of the big frustrating things, is to see mums when you could have helped them 10 years ago. So it's so great if we get mums 6 weeks in. Shoulders back and down, open your chest.
Elrina teaches rehabilitation exercises to help avoid future problems. The women here have all had babies recently.
So what I'd really love to know is, what were some of the things you struggled with?
I felt like, quite literally, I had been ripped apart down there. I got told, you are so close to having a prolapse. And that was the point I went, oh dear Lord.
After the first my emergency cesarean, my body took a lot of strain and it was difficult. My recovery was difficult. As you probably know, you get discharged from hospital with 0 aftercare advice when you've had a cesarean.
I didn't know how recovery was going to go for me. I didn't know if I would recover. And it was just a big dark cloud over that period. And people don't really talk about it.
Why do you think people don't talk about it?
People are embarrassed. It is embarrassing, I lost all control over my bodily functions for quite a while.
We're almost supposed to have a baby and get on with it, so natural. So when there is a trauma, you feel a bit inadequate. And that's just not the case at all. No. And that when you find that out, it feels a lot better, and then you can find the solution or find a way to get better.
Yeah.
Those women are absolutely amazing. It was fascinating to hear their experiences of how their bodies have changed after having a baby. And for some, it's been very traumatic. But the work they're doing in there to help rehabilitate their body is going to stand them in good stead for later in life.
For these women, there is one area that is crucial to a full recovery: their pelvic floor.
Keep your shoulders back and down, open up your chest. That's it.
1 in 4 women experience a pelvic floor disorder after having a baby. And as the years go by, if they're not strengthened, the pelvic floor muscles can deteriorate, causing incontinence and even prolapse when organs in the pelvis slip out of place. This can occur even 40 years on. Meet Gillian.
Gardening is my passion, my joy. Around here is the path through the burgeoning woodland area.
The birth of 3 children during her 30s took its toll on Gillian's pelvic floor muscles. Over the decades, they've weakened further until she's been left living with the worst-case scenario.
I cannot do what I used to do with this prolapse. It stops me all the time. I can't get down and roll up my sleeves and get to work and get my hands mucky. I just can't do it, and it's hurtful in a way.
Gillian's pelvic floor muscles are so damaged they're failing her. These muscles support our bladder, bowel and uterus. When they fail to do their job, the most serious result is a pelvic organ prolapse, like Gillian's, where one or more of the organs have slipped down into the vaginal passage. It can protrude out of the body, causing infections and incontinence, as well as severe discomfort.
I'm sitting on a cushion. This prolapse is between my legs, and it is uncomfortable for me. There are times when I would get up from here to go to the house, to go to the loo, and I don't get there on time. And I find that I wet myself. And a prolapse affects how you wee. I even wee backwards. Now, can you imagine the embarrassment where you get off the loo and your wee is all out the back? This is a real condition, you know, incontinence and prolapse and so on, which very few people talk about. It's embarrassing. I do enjoy marmalade, especially if it's got ginger in it.
Over the years, Gillian has done her best to rectify the condition. She's lost weight, been to a specialist physio and practiced Pilates to strengthen her pelvic floor. But she's now enduring repeated urinary infections and the situation has become unmanageable.
My GP is rather worried that I'm on so many antibiotics, had so many UTIs, concerned about my general health, so I've got to have this operation.
As the prolapse is so extreme, Gillian has been advised to have a hysterectomy, an operation to remove her uterus or womb. She'll also have a procedure to surgically reconstruct the vagina, which will help to support the bowel and bladder.
Thank you, Miss Bray.
Today, she has her pre-op meeting with her consultant urogynecologist, Miss Rhiannon Bray.
So, Gillian, how has the prolapse been since I saw you last time?
Well, actually, it's getting very, very uncomfortable now.
Okay.
The prolapse comes down quite a lot.
Okay.
And I just thought I'd show you this photograph that my darling husband took of me the other night.
Thank you. Yeah, so I can see it's coming all the way to the outside there.
Yes.
That can be really uncomfortable.
Gillian's prolapse is so severe, the internal walls of the vagina are collapsing and protruding out.
You can see the degree to which the prolapse is affecting you and how much the effects it's having on your bladder and bowel is really important, because that tells me that we are at a stage where we need to do something about your prolapse. So the operation that we've planned to go ahead with is called vaginal hysterectomy, pelvic floor repair, plus sacrospinous ligament fixation. So the vaginal hysterectomy part means removing the womb through the vagina because the womb is coming down, plus pelvic floor repair, which is lifting the bladder at the front wall of the vagina and then pushing the rectum back at the back wall of the vagina.
There are various operations and procedures available on the NHS to fix prolapses, depending on the location of the prolapse. From pessaries inserted to support the internal organs, to operations to lift and hold up the uterus. In Gillian's case, she and Dr. Bray have decided that removing the uterus completely is the best course of action.
How are you feeling about the operation?
Well, I'm rather comforted to know that there's going to be some really good needlework going on in this operation.
Sleep problems can affect anyone, but statistically, women are 40% more likely to experience insomnia than men. And on average, women between the ages of 30 to 60 get only 6 hours of shut-eye a night during the working week. That is simply not enough sleep. So why is this happening to us?
There's compelling evidence that insomnia is yet another issue driven by our hormones. A recent survey found that 65% of women aged 55 to 64 experience sleeplessness, confirming it is a symptom of the menopause, making it more common than having a hot flush. But the same survey also revealed that 52% of younger women aged between 30 and 44 also have issues sleeping. So, what can we all do to finally get some sleep? Looking for answers are 3 women who are sick and tired of suffering sleepless nights in silence, and they're going to be putting this lot to the test. Introducing Hannah and Jenny.
I haven't slept well for the past 2 years and it affects my daily life, work life, and it's a real pain.
I'm really sick to the back teeth of insomnia. It really is the pits, and I'm just so excited to try something new.
Our third tester, Julia, is joining us remotely.
Julia, hello. Hello. Hi.
Hiya.
Thank you. One tea, one coffee.
Thank you.
Pleasure. How are you this morning? How did you sleep last night?
2 hours. 2 hours.
Okay, I don't understand how you function with that
You don't.
little.
Neither do I. Neither do I.
I'm permanently exhausted. There'll be days where I literally have to go to bed for the afternoon.
These women are experiencing long-term insomnia, which in their case is most likely to be a symptom of the menopause.
Let me ask you this. What have you tried?
The usual things, diet, avoiding certain foods, late at night, drinking alcohol, not drinking alcohol.
Yeah. I've been prescribed sleeping tablets that have worked and been phenomenal, but you can only take them for so long because you get addicted.
But do the drug-free options actually work? Earlier, we enlisted insomniacs Jenny, Hannah, and Julia to test possible solutions for their sleepless nights. We've selected 3 different approaches for the women to try.
This one.
Oh, gosh. Need a hand?
I'm glad I work out. So this is a weighted blanket.
Weighted blankets use pressure therapy, which claims to have a calming effect on the nervous system and encourages your body to release the sleep hormone melatonin, which in turn makes you sleep well.
Next up, we're going a bit sci-fi.
This is one of the latest developments in sleep technology. Placed under your pillow, this brain frequency device emits a series of silent electromagnetic frequencies, mimicking those of the brain of a good sleeper. It claims to train your brain to follow the same cycle, allowing you to fall asleep and stay asleep. And the final and cheapest product is yoga.
I think we all know that yoga is supposed to help reduce stress, help reduce anxiety, which has the knock-on effect of making it easier to fall asleep and have good sleep. You're going to meet a woman who's going to teach you the stretches that you should do before you go to bed that will encourage deep sleep. So 3 very different products.
Yep.
So we'll see which one, if any of them work. Oh God, I'm really rooting for you. You are both stroking that so much. And I know that both of you are really tired. If I just lay you on the floor right now, oh, look at you. Oh, darlings. You just need sleep, don't you?
Our testers will trial the products as per the instructions for a total of 6 weeks. They will use each one for 2 weeks each, rating them out of 5 for ease of use, value for money, and effectiveness. Our third tester, Julia, will receive the 3 contenders and knows the testing criteria.
I look forward to having a go with these.
All right. Fingers crossed they help you get some sleepy bye-byes.
Later, we'll catch up with all 3 testers
It's like Christmas all come at once.
and find out if any of these options actually work.
Place under your pillow and wait for your sleep to improve. So seems pretty straightforward.
Earlier, we met Gillian, who has endured years of discomfort due to damage to her pelvic floor muscles, resulting in a prolapse. Her pelvic organs have slipped down, causing infections, incontinence, and pain. But finally, she hopes to have found a surgical solution.
Today is a really big day. Gillian's having an operation to fix her pelvic organ prolapse, and she's going to let me watch it. I'm going to find out how she's feeling.
Hello, come into my little room.
I mean, it's fabulous. Look at this. How are you feeling this morning? It's the big day.
It's been a long time and my conditions got worse, so I really can't wait to get down to the theatre.
The operation takes around 2.5 hours, and Gillian has opted for an epidural, which means she'll be numb from the waist down, but conscious throughout.
So we're starting now, about to start the hysterectomy. Knife, please.
Around 55,000 hysterectomies are performed in the UK every year. 1 in 5 women will have one. This could be for several reasons, from severe fibroids to cancer to prolapse like Gillian's. Although it's performed routinely, it is a major operation with a long recovery time.
Can I get a swab on a stick, please? So now we have done the hysterectomy, and now I'm just fixing the prolapse at the back wall of the vagina, and then we're going to start closing the skin. So we're towards the end now of the operation.
So that's the uterus attached to the cervix, yes?
Yes. If you want to see it, you could
why
in the
not? I mean,
pod.
it's been in my body for so long.
No, I feel like I owe that to you, if you're not too squeamish.
No, I'm not screaming. Oh, is that all it is?
Exactly, all that fuss
My
over that, is
goodness,
that
all
all?
that fuss.
Cut for me.
uterus, that's the cervix there.
Gillian, are you poking it?
Yes, I am poking.
I mean, not many people get to do that.
I'm amazed.
This is a once in a lifetime.
When I consider what that has done for me, giving me 3 beautiful children.
Isn't that extraordinary to see?
Well, my pleasure.
So now the last few stitches on the skin, just on the perineum, between the vagina and back passage, and that's the end.
Like all operations, there are risks. Risk of infection, bleeding and injury to the surrounding organs, and the chance that the prolapse may reoccur. Gillian will need to remain in hospital for at least 2 days afterwards to be closely monitored, and then the recovery time at home will be between 6 to 10 weeks. Later, I catch up with her to find out if the operation was a success and if the infections and incontinence are now a thing of the past.
Everyone do a pelvic floor squeeze. Ooh. Okay.
I've been looking into the various medical issues that can arise after pregnancy and birth, some of which can linger, causing problems for years.
The lady I'm about to meet, 4 years after the birth of her 3rd child, is still really feeling the effects of pregnancy and labour.
Miguela has been experiencing back pain and discomfort in her abdomen since the birth of her children.
I've had 3 children, 3 beautiful children, of whom I'm very proud of. Now that the kids are older, the focus is how do I feel about myself? And the condition that I have is diastasis recti, which is the splitting of the abdominal wall.
Diastasis recti is a really common condition after pregnancy, with 1 in 3 women still contending with it 6 months after giving birth. The muscles that run down the middle of our abdomen generally separate during pregnancy, but they should move back together after the birth. However, for some women, the muscles are so stretched they're unable to move back, leaving the belly distended, which can cause serious back pain.
Diastasis affects me in a way that I feel that I'm not able to give my all in some activities. I can only stand for 15 minutes because I get this really severe backache, which then forces me to sit down and take a rest. But the biggest aspect, I would say, is the way that I look because of that condition.
Fed up with the discomfort, Miguela has had enough. I've arranged to meet her to find out more about her condition.
Hey!
Hi!
And what she can do about it.
When did you realise that you had diastasis?
I looked it up and then realised, oh, that's why I'm experiencing such things. It's most likely that I've obtained it through the 3 pregnancies that I've experienced. And it seems to have gotten worse after every pregnancy because I have heavy babies, which are 10 and a half pounds.
Oh my God! How much?
Yeah, 10 and a half pounds, yeah.
So your stomach muscles are kind of doing their absolute best to keep these babies supported. And then, of course, you have the baby and they haven't knit back together.
Yeah.
How does it feel for you? What does it feel like?
So pain in that core area. If my youngest child were to come and just rest himself against my stomach, I have to tell him to get off. And then sometimes you can feel maybe the organs or something.
If extreme cases of diastasis go untreated, there is a risk of hernia, where internal organs can protrude through the gap in your abdominal wall.
Once you knew that you had this condition, what did you do?
The first thing that I went to do is to find out how bad it is. So I then found out that I had a gap of 4 fingers.
So you can fit 4 fingers in between the muscles.
Yeah.
So that's a gap of about that big.
Yeah, this is severe, severe diastasis, yeah.
That must be really uncomfortable.
Yeah.
Miguela found a medical consultant who specialises in a non-invasive treatment to repair the abdominal wall.
So I just need to do your weight, your photos, and then we're going to measure you.
Yeah.
So completely relax.
Yeah.
Today is the initial assessment, and she's invited me along
Sure, come in.
to meet her consultant, Dr. Ejikemi.
So diastasis is essentially the abdominal muscles part. And as the uterus grows, so the baby in the uterus grows, the body has to adjust to give space.
Even before pregnancy, we all have a small gap between our abdominal muscles. It's only when the muscles are overextended and the gap widens significantly that it causes problems.
It's a bit like opening the sunroof, and then for some women, it just doesn't close again.
Yeah.
What are the issues as a consequence of that?
The point of these abdominal muscles is they give you stability. So if you don't have that core strength, you're going to end up using other muscles to twist, to turn, and that can lead to poor posture, that can lead to backache, shoulder ache, hip girdle pain, even constipation. Now, the primary treatment to help is physiotherapy, and doing some gentle exercise can be really helpful. You know, some people think if they work really hard, if they do loads of sit-ups, it will help. That actually can make things worse.
After finding out that I had diastasis, I then realised that all of the hard work that I'd put into working out was actually worsening my diastasis. So it was a bit of a disappointment for me.
With the muscles so splayed apart, repeated abdominal exercise can actually exacerbate the condition.
And you can see this,
Absolutely.
and then relax back.
By forcing the internal organs outward and risking a hernia.
So is that the internal organs trying to come out?
Yes. So that's like the large intestines or the small intestines. And normally they're just completely shielded by the intact abdominal wall. And when there's a bit of a breach, they're all wiggling around, and that pressure just moves them forward a little bit.
Dr. Ejikemi uses a body contouring machine to treat cases like this. It stimulates the muscles to contract using electromagnetic pulses. In approximately 4 sessions, the abdominal muscles will have edged closer together without putting strain on the organs from repeated sit-ups.
It's going to start at about 20%.
How does that feel?
There's a bit of that tingling sensation.
Okay.
Yes.
As the muscles contract in this controlled position, they will gradually edge closer without risking a hernia.
So if someone's abdominal muscles are like that, there's no point in saying to them, get into the gym and do your workout, because they can't get them anywhere near each other. They can't even activate them.
Absolutely.
Wow. That's amazing. I feel like the muscles are like coming together.
Yep.
Miguela will start with 4 sessions, 1 each week, before the results are reviewed. This treatment is not available on the NHS and costs around £400 per session at a private clinic. Earlier we met Jenny, Hannah and Julia, all shattered from insomnia.
I don't understand how you function.
Neither do I.
There'll be days where I literally have to go to bed for the afternoon.
They're test driving 3 different drug-free solutions that claim to help a good night's sleep.
I've noticed a little bit of difference in terms of the quality of sleep that I've been getting.
The weighted blanket, a brain frequency device, and bedtime yoga.
Oh, look at you. Oh, darlings.
Lack of sleep night after night has had a profound effect on these women's lives.
It is horrible. I have had, on average, 2 or 3 hours a night's sleep.
I could just get me the one 6-pack of eggs, that's fine. I'm a really busy person. I'm a mum, I'm a wife, I run a household, I work full time. So not getting sleep and therefore not being able to be prepared and have the energy to do all of those things can be devastatingly negative. I can see why many years ago it was used as a form of torture.
You can be at work and just completely forget things or just have a complete exhausting moment because it'll come over me at any time. All of a sudden, boom, I needed to go to bed.
Sometimes I think, I wonder what I could have achieved if I'd had 8-9 hours sleep that everybody else gets.
Could they be about to get the shut-eye they so desperately need?
It's like Christmas all come at once.
Over 6 weeks, our testers will follow the product instructions and use each product for 2 consecutive weeks. First, the brain frequency device.
Not quite sure what you do with this, but
Surprisingly lightweight. If I switch it on, it doesn't emit any sound or anything.
This gadget sends electromagnetic frequencies to the brain that mimics the 4 sleep cycles measured in the brain of a good sleeper.
The first 20 minutes of the cycle consists of alpha frequencies. I've never heard of alpha frequencies, so more Googling later on, I think, for that one.
The theory is, with the device placed under your pillow, your brain should sync up with the frequencies, helping improve the quality of your sleep within 3 weeks.
unplug nearby electronics, place under your pillow and wait for your sleep to improve. So seems pretty straightforward.
Oh, blimey.
Next, the weighted blanket.
This is really heavy.
I'd say that's probably between 6 and 8 kilograms, possibly.
Made with microfiber and filled with millions of tiny glass beads, the sensation of it weighing down on top of you is supposed to boost levels of sleep hormones while decreasing the stress hormone cortisol.
I've never used anything like this before.
Please work.
And finally, there's yoga. Our testers are learning specific poses and techniques that are said to help them sleep.
It's a really wonderful thing to do before you go to sleep, or if you wake up in the middle of the night and you can't get to sleep, to stop your mind getting caught up.
I have my fingers crossed this is going to help with my insomnia.
So, will any of this lot actually lead to a good night's sleep?
Feels nice. I like it. Alfie likes it.
We'll find out later.
You can just snuggle down.
Earlier, we met Miguela, who after 3 pregnancies was left with diastasis recti, significant damage to her abdominal muscles that causes severe back pain and risks hernia. She's received treatment using a body contouring machine to reposition her core muscles, and today she's back to be reassessed by Dr. Ejikemi.
We'll examine your tummy, and then we'll examine to see if your diastasis has changed and where it is. How does that sound?
Sounds good to me.
Miguela's abdominal muscles were so overextended that they were unable to contain her internal organs, which were beginning to protrude through the widened gap known as a hernia. She's hoping the treatments have started to pull her stomach muscles back together again and will rid her of crippling backache.
Now, you may not be able to do this yet, but what I'd like you to do is to try and tense your tummy.
Okay.
Again.
Like that?
Brilliant.
That is so amazing.
You can feel
Yes.
you're able to do that.
That's right.
Brilliant.
You've got strength in your stomach. Do you feel like you're being knitted back together?
I do, yes. I feel like it's coming together, yeah. It was very painful, very painful. So I couldn't do the washing up, stay standing for however long. And I love to cook, you know, staying in the kitchen for the whole Saturday, just cooking different meals. There will be a point when I can no longer stand and I need to be seated.
Have you noticed that you are getting less back pain as you do more of these treatments?
I have actually. I'm starting to feel like myself again.
It's really interesting that you feel it mostly in your lower back, because if that's the area that you need the abdominal muscles to be knitted together to support your lower back. And without that support, you arch the lower back. Yeah. So being able to engage your tummy, you release the lower back, and it means that you can stand, have better posture without the pain.
Miguela has now received all 4 treatments in the course. During the initial consultation, exact measurements were taken to record how pronounced her diastasis was.
So I measured the largest circumference, and that was 101 centimetres, and you are now 93 centimetres. So you've lost 8 centimetres, which is equivalent of 2 dress sizes.
Wow. Amazing.
That's absolutely amazing.
Now, more than that, I want to show you something. Okay. So I want to show you a side by side.
Wow, that is amazing.
I'm speechless.
Wow, look at the difference. I mean, it's literally up and in. Look at the muscles.
Amazing.
This is just getting the function back in your abdomen so the abdominal contents sit where they should be and your abdominal wall does what it's supposed to do.
Wow, I'm actually quite blown away.
Wow.
For over a decade, Miguela has been putting up with discomfort from an issue she's been unable to fix.
As a lady, you give so much to everybody, and I feel like this has been my way to focus on me.
Yeah.
Which is very important.
Yeah.
It's been a long time.
To focus on ourselves and making sure that we are okay.
Yeah. The back pain is improved.
Indeed.
You can now focus on the things that you enjoy doing.
I look forward to it.
In that moment, I've really understood how much this affects Miguela. It's not a small thing. This isn't about vanity. This affects every part of her life. And I feel like today she got some hope.
Thank you.
Yeah.
Earlier, we were allowed to join Gillian in theatre as she underwent a major operation to repair a serious pelvic prolapse.
So, it's been 3 weeks and 2 days since Gillian's operation, and I can't wait to see how she's getting on. How are you?
Wonderful. The first thing that I was aware of was the fact that I didn't have this lump between my legs that was continually there, poking out and getting in the way and being very uncomfortable. That was gone. And no longer am I getting up all the time to go to the loo during the night because my prolapse would be pressing on my bladder and affecting it.
So it's a huge relief to have that bulge gone.
That was a wonderful feeling, a great relief.
Do you think you would have been able to cross your legs with the bulge?
Oh, God, no.
So is this quite fun?
Oh, it's wonderful. Yes, I can cross my legs. Come through, come through.
Gillian, I keep forgetting that you've just had a major surgery. You seem really mobile.
I can walk.
Look, that's good.
And walk upright. I've got to do my exercises, hold my stomach in.
Right, pelvic floor.
And pelvic floor, definitely. Oh.
I am so relieved to see Gillian, not just on the mend, but in such good spirits and looking forward to the future. So many women hide these problems that occur after childbirth, and I am so glad that Gillian's been really brave and she's talked about it in a really matter-of-fact way, because it's women like her that give other women permission to ask questions and get help.
6 weeks ago, we met 3 women, all who struggled to get a good night's sleep. So I sent them away with 3 products to test to see if their sleepless nights could turn into sweet dreams. Their brief was to try out 3 products for 2 weeks. The weighted blankets, the brain frequency device, and the sleep-inducing yoga before bed. There's Jenny.
I like the yoga so much, I've come to a class at 10:30 on a Saturday morning.
Julia.
I've heard good things about these before now, but I've never tried one.
and Hannah.
So I used this last night and really impressed actually.
Each product uses a different principle to send insomniacs off to the land of Nod. The brain frequency device claims to influence our brainwave activity throughout the night using the silent electromagnetic signals.
Turn it on, tuck it under your pillow and go to sleep. Night-night.
Sleeping under a weighted blanket is supposed to calm our nervous system and stimulate hormones melatonin and serotonin, which make us sleep soundly.
Crikey, it is quite heavy.
And practicing specific yoga moves before bed is said to relax both our bodies and minds.
Let's see how this goes. Night-night.
Now all three women are back to give us their verdicts.
Hannah, Jenny and Julia, welcome!
Hi.
Hiya.
So, you all look really well. How have you found the products?
It's been interesting.
Really good. I'm actually feeling good.
You look really great.
Thank you.
You look well slept.
Yes.
Is that a real thing?
Yes.
Jenny, you look well slept. No way! Oh my God, I mean, I feel it's electricity coming from you.
Yep.
On top of the world?
I can conquer the world now.
I can't believe I'm hearing this.
I've literally had maybe 3 weeks of sleep now with one night not. Normally it's 3 weeks with 1 night sleeping.
I can't believe you're saying that. Okay, Julia, how about you?
I've noticed from using a sleep app that I'm getting much deeper sleep for longer, which before would have been maybe 24 minutes a night some nights.
Yeah.
How does it make you feel, this sleep?
Good sleep just allows you to be able to cope with anything that is thrown at you as a mum, as a colleague, as a person. It keeps you stable.
It means you can tie your shoelaces in the morning. You can go shopping, you can do your emails, you can read your book, you can watch the TV, you can go out with friends, all in the same day.
You don't find your keys in the fridge and the milk in the cupboard.
So I'm actually blown away by the energy and happiness I'm getting from you, and I'm over the moon that things have worked. What I really want to know is which of the products has done this for you?
The testers have rated all three products out of 5 in 3 different categories: ease of use, value for money, and effectiveness. The scores in each category will then be averaged and added together to reveal the overall winner with a score out of a total of 15.
So I gave you all 3 products to test at home, and these are your average scores. And running in last place is yoga.
I love it during the day, but last thing at night, you don't have time. You don't have time.
Not necessarily the most practical thing to do at 4 o'clock in the morning when you're trying to get back to sleep. You don't want to disturb your partner.
I totally understand that. Fantastic during the day, not practical at 4 in the morning. Okay.
All 3 testers enjoyed doing yoga, and it scored well for value for money, but were not so generous when it came to ease of use and effectiveness, giving it an overall score of 9 out of 15.
In second place is the Sleep Pebble. What do you think about that?
I'm shocked because it's my miracle cure. I'm thinking they haven't given it enough time.
Oh, spicy! Well, for you, it was just a dream, literally.
Yeah.
It was sweet dreams for you.
Yeah.
Hannah, what about you?
I liked it. You know, it was fine. But again, I had to remember to charge it, so there was a few things that, you know, you had to depend on yourself to remember to do. But yeah, it was good.
Jenny gave this top marks and claims it's had a truly life-changing effect. But at around £300, it's an expensive bit of kit. And that was reflected in the testers' value for money scores. In the end, combined with Hannah and Julia's scores, it brings this electromagnetic device to 12 out of 15.
And then finally, the winner of the sleep challenge is the weighted blanket.
Yay!
I'm not surprised. I almost feel like I've got my life back.
That's absolutely enormous.
It's just so easy to use. It did work for me and it gave me deep sleep, which I was shocked because it was one of the first things that we used. But for me, it was just too hot, so it wasn't very practical for a lady of a certain age.
In the end, the weighted blanket pipped the brain frequency device to the post with a final score of 13 out of 15.
I've just got a new job, I'm back at the gym, I'm happier, I feel just on top of the world.
I'd enjoy life again without feeling like you're wading through treacle every day.
Yeah.
What would be your advice to other women who are struggling with their sleep?
Try everything, literally everything.
And I think also don't give up after a couple of nights. You've got to persevere for a little while to see if it's going to make a difference, because your sleep habits won't change instantly.
No.
It does take a little time to give that product a chance. So give it a go.
Those are 3 bits of very wise advice from some very well-slept women. I'm just thrilled to see you all looking so well and full of beans, and you're just going to go and conquer the world.
Thank you.
All thanks to a bit of sleep.
Do you want to come with?
Hey, if it involves sleep, I'm there.
The information given within the series about medical conditions and treatments is provided for informational purposes only. Advice on any of the issues featured should be sought from a medical professional.